Good evening, everyone. My name is Sheila Awala, Senior Residency Specialist here at Residency Medical. Thank you so much for joining us this evening for our webinar, What Do Program Directors Look For During the Residency Interview. As you can see behind me, this is our wall of past candidates we have successfully helped pass residency. I'd like to pass it over to our Chief Academic Officer, Dr. Michael Everest.
Okay. Hello, everybody. Dr. Michael Everest, Chairman and Chief Academic Officer at Residency Medical. It's a pleasure to have you on board, and I want to wish everybody a happy Thanksgiving. I would like to start by introducing what we do at Residency Medical. We are an education organization, first and foremost. We prepare our students and candidates, and we create a pathway to help them integrate in a program, strengthen their curriculum vitae, and hopefully, based on their merits, achieve a medical residency and go on to fellowship. It is my heartfelt desire to really create doctors that will uplift the community that they work in and to go into academic medicine. I think that the future leadership in medicine is always academic medicine, especially in a time now when we're getting all of these unprecedented things happening in our environment, both on a public health level, a clinical level. A time to have the future leaders in academic medicine is very important. I will be introducing to you a distinguished guest of ours, Dr. Yoder, the poster child for academic medicine and just self-sacrifice. He works alongside me on our consultancy of starting new residency programs and helping government institutions. So he brings just a plethora of knowledge, but also a holistic approach in this atmosphere. I was just having a chat with Dr. Yoder, who is the founding dean of Central Michigan University and the current director of medical education at Detroit-Wayne County Health Authority. So he has dedicated his life to the wonderful state of Michigan and has helped thousands of people realize their academic postgraduate aspirations. And he will be giving a presentation, and then him and I will have a discussion on it. And then we will take some questions at the end of this webinar. And I would ask Dr. Yoder to also close at that point, and then we'll go about our ways. So Dr. Yoder, please.
Thank you, Dr. Everest. It's a pleasure to have this conversation with you, and I will try to keep the formal remarks short so that we have ample time for questions. So basically, when you think about the residency selection process from the perspective of a program director, they're faced with having to screen through large numbers of applications. So in our current residencies, we match approximately 23 new residents a year, and we receive approximately 3,500 applications for those 23 slots. So, you know, there is no way that we have the manpower to read, unfortunately, every aspect of every application. So we screen for the best fit candidates, considering our mission, vision, and values, and those of the candidate. We obviously want to identify those individuals that have the highest likelihood of succeeding in residency, as well as success in the specialty certification exams. Also as a fit for our community, or if you're a hospital system, the health system that's served, and try to minimize the amount of time required to review applicants so that you can get down to getting to know the applicants to make a match list. And as part of this, obviously, to meet the requirements of the ACGME. So most program directors will start with a large number of applications in the ERAS, the Electronic Residency Application System, and they will look at USMLE and COMLEX scores, and those people that have had failures, especially multiple failures, will many times be screened out. One of the key exam performances that will be looked at are the mean score it is for a mean score on step 2 of either COMLEX or USMLE, is that it has a high correlation with success on specialty boards after residency. And then they will obviously give consideration to those individuals that they know well. So if someone is from their medical school or has done a rotation there, they will know that person better than you can obviously glean from exam scores and so on. And then in the next step, it will be really focusing on fit, so that you're looking at more extensive data from each of the candidates. So they'll read the personal statements typically, looking for the fit indications of the values of the individual and their commitment to that specialty. They'll look at the medical school performance evaluation, or AKA the dean's letter. Some highly competitive specialties are concerned about class rank. Some primary care specialties that are less competitive may not look at class rank. Letters of recommendation, in particular department letters. So many medical schools now have a committee that includes the faculty that work with and supervise students. Will put together a composite letter under the signature of the dean, of the chair or a vice chair that is standardized and is maybe very helpful to the program directors looking at candidates. They'll look at things like the volunteer and service learning record of the student and the kinds of things that the student did. They'll look at their measures on the entrustable professional activities and their performance on the competencies. Some programs will look at whether there is evidence of scholarly activity and research. That is not important to all programs. And then also consider the demographics based upon the population served, trying to select residents that would be recognized as potential members of the community that's being served. So we utilize, and most places utilize, the Association of American Medical Colleges classification, and we'll try to balance the residents taken into each program to be reflective of the community that is served. Some areas that may or may not be attended to are things like students that come from low socioeconomic status, because they have a history of serving those populations that are underserved when they go into practice. And then depending again upon the population served, the geographic background, trying to accept residents that are from a rural or urban environment. So this will generally be done in concert with a review of the medical student performance evaluation or transcript, looking for failed or repeated courses, failed or repeated clerkships. Did the student participate in difficult or challenging rotations? In other words, did they work hard as a medical student in year 4 to prepare for residency? Did they require an extended time in medical school, and if so, why? And did they have professionalism issues? And this is a key one, because professionalism issues, among other challenges that students may face, can be among the most difficult to address. And then finally, they will consider, in some cases, the reputation of the student's medical school. Let's see.
Dr. Yoder, may I?
Yes, please.
Maybe you and I can discuss a couple of notes that I made that may be helpful to what I see on pages 1 through 4 is that there has to be, pardon the pun, a good match between the program and the students. In my almost 25 years of experience in this, there can be someone with really high scores, but they won't mesh well with the program. So that's why I'm a believer in program integration. Like you said, rotations. If you can get out there and get somebody's real worth in real situations, I think that a lot of things not only get overlooked, but it strengthens the application. I'll give you an example of a student I have now. He's got great scores, full of research, but he's out in New York. He's doing a clinical research tenure, and we came away with an idea on how to get them integrated. In New York, there's a surge, and they're giving COVID-19 emergency licenses. So we advised them, go get a COVID-19 license. Some of the residents are down, some of the staff is down. It's the holidays, they deserve a break. So he's gonna go get a COVID-19 license, a temporary license, and get on the floors and help. What does that show? Dedication, professionalism, like we were talking about, and his IMG status. He's got good scores, but whatever apprehension someone may have out of the 2,500 applicants that are there for the handful of positions, when you're on the floors with someone really in the nitty gritty, I think that makes a huge difference. If you can, and the program director or the dean or the medical director will see, wow, this kid's thinking outside the box. He's willing to run to the storm rather away. I mean, last year, last season, not even here, 2020 is still here, I had a friend of mine from a Jersey medical school, and he was telling me, Doc, I've got my US grads, they're deferring their residency. They don't want to deal with this. So what do? You know, I go down and I recruit people that are really, really willing to go. So I think that was a very, very good point. And the screening criteria is so important, especially now step one going into pass fail. Step two is so important. And what we found is a way to mitigate some of this is, especially if you're an IMG, but I think all around, have your step three out of the way. It shows, like Dr. Yoder said, you're not wasting your time, you're working hard. And if you have lower scores, then what we suggest our students to do is go take the ITE if it's internal medicine. So if you have these lower scores, but you go get a 75 percentile in your ITE, it'll show the individuals, he's not a resident, and he's getting these scores, he's not gonna have a problem passing the boards and getting my program a date. So I think that these are all ways to think how to strengthen and distinguish your application.
Yeah, I agree, and I would only add one thing to that, and that is that when in the programs that I have operated, where I've been program director or above, we have once we've done the initial screening with the USMLEs, and we have included those people that we know where the USMLE is superseded by our direct experience with an individual, that those that are on the committee that are reviewing personal statements, letters of recommendation, and other measures do not have access to those board scores because we don't want to inadvertently influence their assessment of the person's fit for our program.
It's very good. And again, thank you for bringing that up. And going on to the personal statements, keep it concise. You don't have to talk about what you did when you were 6 years old, unless it's got, like Dean Yoder said, they've got thousands upon thousands. And they have a small, especially this year with the virtual stuff. Keep it concise, keep it dedicated to your specialty, whether you want to go into family medicine, internal medicine, or dermatology. No one wants their specialty as a second best because they've dedicated their heart and soul to that specialty. So if you're going for internal medicine, then you better darn well show on your curriculum vitae and personal statement that you want internal medicine, not, well, maybe internal medicine, maybe family medicine, because I think that the dedication is what the leadership looks for, and especially now that it's committee-based. Back yonder, it used to be, you know, one person making the decision, really, maybe two. Now, I mean, it's a real group effort. You know, you get votes and you have a little piece of paper with a chart and certain parameters that have to be met. So all of that is important. LORs. With LORs, there's kind of, I don't know how to put this, maybe Dr. Yoder put it in a more polished way, but an LOR has little telltale signs to see if this is a good LOR or a generic LOR that a trained eye sees, like Dr. Yoder.
Yes.
And yeah, those are all very important to.
Yeah, I'd say one of the most critical elements of a letter of recommendation is that sentence or two where the individual writing talks about how they came in contact with the student, the kind of work they did together, the relationship, and then comments on their strengths and weaknesses. And, you know, establishing that there's this legitimate relationship, in particular if it's over a period of weeks to months, is extremely important.
Absolutely. Great, thank you. I just thought it would be a good idea for us to
Dope. Oh, I love it. This is great. So other things that program directors may take into consideration are, do you have linkages to the state or that region? Do you have family in the area? Is your significant other from the area? Did you grow up in a similar environment? And then in some places, and this is true of Michigan, do you have indebtedness that could qualify you for repayment or loan forgiveness? And some of these programs actually can be implemented during residency. The program directors obviously must adhere to ACGME standards. So they'll be watching to make sure individuals will be successful in specialty boards. And they'll also focus their recruitment practices that will attract, in an ongoing fashion, mission-driven recruits that are retained, and they're diverse and inclusive as a class. And so this is now a requirement of the ACGME for program accreditation. So I'm going to move to interviews for a little bit. Most places will plan their interviews. The interviewers should not see the boards and so on to avoid bias, but that may not always be the case. They will base the interviewing upon the selection criteria, such as the program's mission and so on. Typically, these will be multi-person. That may be a small group. It may be a sequence of interviews with faculty, residents, and staff. Many places are doing what I would call situational judgment tests, where they'll give you a case and ask for how you would respond to this, or they may ask you to talk about a case that was really important to you, important in your growth as a young physician. And these methods are moderately associated with resident success, with correlation and coefficients as noted, 0.37 to 0.6. So they will continue to be used. Go ahead.
No, I was just wanting to go over some of this important stuff that you brought up. In coming to the ACGME standards, it is so important, and Dr. Yoder helps hospitals start residency programs, and with us in our new venture together. But ACGME really has milestones and landmarks that are evidence-based that must be met. Scholarly activity does help, but the board pass rates is on everyone's mind, because people want to stay in good standing. Healthcare is a very, very, GME, I should say, is a business, and in order for it to succeed, it has to have certain milestones met for CMS to continue what they do. And it also helps when the ACGME sees the diversity of an inclusive residency, but also that if you're in an area where Spanish is very, very integrated in a community, then while you're at the place, learn some Spanish. Or if in Michigan, I'll just use this as an abstract kind of idea. If you have an Arab population, it would help if somebody speaks Arabic. It helps with the personnel that's needed to translate, and about having the people there that mesh within the community. So the board pass rates and having these idea of knowing where you're interviewing. So if you're interviewing at a program that has an X amount of demographics and you're an X amount of demographic, the leadership may say, you know what, this person may be good to keep on board for 5-10 years because they're investing in you. And the criteria about links to state or region, I had a webinar with a fellow dean friend of mine a few months ago, if you all watched, and Texas, they want you to be from Texas. They consider that a big thing because it's the community. And I think it's important because you have to know your community. It's not tribalism, but it's about, that's where the success lies. If you know the quirks of your community, how it is, and how, that's why if someone spends 8 months with you there doing scholarly activity or even shadowing or externship, and you feel one with the community, it's hard to say no to someone that's got the talent, reaches the milestones, but may have, a lower step one score. They're like, I know this guy. He's good with my community. So community is good, and if your family's from there, if you're committed to the community, then the people that live in that community, that have reared their children there, that have helped the community, see that you carrying on that tradition, because no one wants someone to just come and go. I was talking to a friend of mine at the University of Hawaii, and he's like, people come here for a prelim, they love the weather, but they never stay. And it's hard to retain doctors there, and retention is very important. And also about the diversity inclusion, it is so important to have that, because when you live in, Michigan is unique in that aspect because you have an urban area and a rural area. So if you can get a doctor that served in a rural area, he'll know the rural quirks. In an urban area, there are certain luxuries that are not privy to someone that if you work at Cedar Sinai, Beverly Hills, or if you're working on the south side of Chicago. So if you can get used to that and you appreciate that and you want to help that, that has great value in leaders like Dr. Yoder that see people just not meshed right with a certain geographical background. And it's very important to have success. They don't want to hire a resident because it's a headache to get rid of someone. Forget about all the HR stuff. You want to get somebody, you don't even want to remediate them. Just be quiet, do your work, shine like a superstar, and let's see where it goes from there. This is a time of training and learning while you're earning, I say.
And be prepared to react positively to feedback. That's going to be really critical. And if indeed in your letters it reflects that you are teachable and that you're interested in learning and that you value feedback, that goes a long way toward persuading the program director that you're the kind of resident that they would like to match. And the interviews are successful if they're based on a description of the desired resident traits, and the interviewers are trained, and you'll know this when you participate. They should have standardized questions for all interviewees, and they will rate you consistently on a rating scale with anchors, meaning descriptions, so that they know how to compare applicants among each other. And really good programs will have evaluated over time the success of their criteria and their process. And I put a few references in the slide set that we can share that talk about how residency interviews are done and how important they are. So that's the end of my formal component of the presentation. And so I'd be happy to enter the discussion phase and to take questions.
Absolutely. I'll just add an annotation of a little bit, and then I think we should open up the questions. And in saying that, there has to be an understanding for all you folks out there that there's a hierarchy in graduate medical education. We're not talking about ego, but you're not going to go to Dr. Yoder or his chief resident and how do I say it, call him out or make.
Ooh. I can't hear you. Oh, there's something. Dr. Everest, can you hear me? Okay, because I cannot hear you for some reason now, so. I don't understand. Hey. Yeah. Oh, perfect. That'd be great. Okay. And how will they come, Greg?
Hello, hello, hello.
Oh, I can hear him now. I can hear him. Yeah, we got it. Thanks.
So,
Okay.
we're
Thank you,
not
Sheila.
under pressure. And this brings a very good point. And we've got this high-tech system, I'm sure Dr. Yoder does, and now everyone's doing virtual interviews. So if you have a problem, don't start panicking, flipping out, because this may be a good time for you to show how you are under pressure.
Yeah.
So you couldn't have scripted that better, Dr. Yoder. So I think that, Ms. Sheila, please get some questions, and Dr. Yoder and I will answer them. And then if you would do a closing after that, Dr. Yoder, and then we can call it a day before this thing gets in mind of its own.
Sure. Okay.
So I will take one of the first questions. How should we respond if we get asked what adaptations are we taking in the COVID pandemic in our clinical practice?
Well, so that's quite a question, and appropriate to the environment now. I would say that you need to provide an honest answer. And if you have a condition that makes you particularly vulnerable, that would be a good time probably to disclose the condition. I would hope that, as in the places that I've worked and been program director and above, that would not have any effect on your qualifications for it. It would just be part of the planning phase. We take care of all of our residents, our staff, everybody that we work with, we take care of each other. And so, there should be no bias if you have a rationale, a reason for needing to protect yourself.
No, absolutely. Thank you for saying that. And maybe I'll answer this one, Sheila.
Sure. So the next question is, how should we explain low step 1 scores without exhibiting self-pity?
So self-pity is something that's just very, very irritating. If you have a low step 1 score, give a reason and prove it by getting a high step 2 score, so that you can show, hey, I had a bad day. I wasn't ready for this. My medical school didn't prepare me like they do at Henry Ford. How can I get past this? Is by I've done extensive externships. I have these LORs. Look at the step 2 score I got. So it shows an upward trajectory. Like Dr. Yoder said, everyone wants somebody that is teachable. Nobody wants a powder, feel sorry for you, because there is no feel sorry for me. You have to get up, dust yourself off, and there's 101 ways to prove yourself by working hard, as Dr. Yoder said in his presentation. So maybe you can add to that.
And I would add one more thing, and that is, what have you done to identify the reason for difficulty on the exam? And so have you sought out advice and help on the strategies for, the US style of certifying and licensing exams? Some of the best physicians I've ever worked with didn't go to medical school here, and their assessments and their practice exams and so on in medical school somewhere around the world were more qualitative, there was more oral, there were more lengthy written exams, essays, etc., where they explained rather than identifying one correct answer out of 4 or 5 options. And so those students who have recognized that there's a different exam style and a different way of being successful and have done something about it tend to rise to the top.
Very well said. Yeah, I fully agree.
Great. So our next question is, what are signs to know if the interview went well?
So, you'll feel it most of the time, but in my experience, good committees and program directors will let you know how you did. And they will tend, they can't legally say you're going to be ranked #1 or one of our top 5 or whatever. That it goes against the ethics of the match. But they can tell you that you're a really good fit. We really enjoyed meeting you. your answers to the questions and your questions of us. And that's another thing they'll give you feedback on. Did you interview the program? Were you interested enough that you did homework and so on and came there prepared with questions to make observations and to learn about the program?
Absolutely. And what are you doing, if I may kindly add, what is your follow-up like? Do you have a respectful follow-up email, not begging them, oh, I'm going to rank you, or you're going to, those are match violations, but just be professional. Be professional.
Yeah.
Carry yourself in a way, and usually I've seen things all over the map, but sometimes it's just a matter of being at the right place at the right time. If you really clicked with some of the heads, maybe it was, we had a gentleman out in Boston, and all they really did is talk about hockey after the thing. So it's, did you connect with the people? And you're like you said, you should be able to read the room. You should know if you did well or not, and then you just do a follow up and be respectful, and show that how you are as a person, because everything counts. From the interview on, everything counts.
Confident but humble. It's really important not to underserve yourself, but at the same time, bragging will not cut it. That is something that does not work in this culture.
Meekness, right? Be meek. Couple more and then we'll.
Sure. So the next question is, what is an acceptable median step 2 CK score for internal medicine?
So most internal medicine, so as it happens, I am an internist. Most internal medicine program directors are looking for a score that is near the mean or median on step 2. That is highly predictable for success on the internal medicine certifying exam. And so they'll frequently use that as a screening tool. But remember, if they have a way of having more personal information, and they know your work habits, they know your values, they know how you conduct yourself, how you relate to patients and so on, that can go a long way toward assuaging any concerns they might have by a modest score on step 2.
Absolutely, very well put. Yeah, I mean, it's step 2 now more than ever is very, very important. And I mean, Dr. Yoder reiterates that to us on occasion. So listen to what he said. You're getting a wealth of knowledge. So I'll answer this one. The last one can go to Dr. Yoder, and then we'll.
Sure. Okay. So this question is, I have step scores in the 260s and 270s, but a year of graduation of 7 years. Will my year of graduation cause me to be filtered out before my application can be reviewed?
Well, your scores are very good. So what that leads me to kind of ask is, why haven't you matched in 7 years? Is there something that's missing on your application? What specialty are you going for? And where is your clinical experience? Medicine has changed in 7 years. Have you been in the lab? Have you been, did you decide to be a musician and come back? There's a correlation there with very high scores, and why didn't you match? So you have to explain that. And it's best to go in and really just integrate in a program. If you haven't integrated, then get in there, spend a year, and show your worth. Those are the questions I would ask. But to answer your question, will it get filtered out? There is a 5-year mark, especially if you go to the HCA system, there's a 3-year mark. But it all depends on what your personal statement says and your CV says.
I agree. I think that those are all very good points. And the key, so if you make it through the screening, which those scores clearly would, but somebody sees this 5 or 7 year thing, if you have not been clinically active in those years, it is highly likely that you will be screened out.
Absolutely. Real clinical experience is so important. And we're not talking telemedicine rotations, which fine, that's all you can do in March. We're talking getting to a place, Michigan allows it, Florida allows it, not all institutions, where you're doing hands-on clinical stuff. Because that shows your worth, shows your team ability to work well within a team, your ability to function in a variety of settings, whether you show sound judgment. These are all things that a program looks for. So get the right type of hands-on experience. There's a lot of these organizations that are sending you here to a doctor's office to be amongst 20 other people. That may not be your best chance. use this advice I just gave you with a keen amount of interest, because it's worth it gold.
Yeah, that's really spot on. The letters that you get from those clinical rotations are really, really important. And if the letter writer can talk about your clinical skills and talk about how well you work with the team, how you participated in interprofessional education, those are really key measures.
So the last one to Dr. Yoder, and then we'll.
Sure. So there's a lot of questions, and I'm sorry we cannot get to all of them, you guys. There's quite a few attendees who are with us today, but I'll take this one. How many interviews are needed to be safe for internal medicine, Dr. Yoder?
So the advice that I've been giving students for a brief 35 years of participating in this is that they, and by the way, this will be a little bit stratified depending upon how strong a student they are, but somewhere in the neighborhood of 6 to 10 interviews should be adequate in almost all cases. And when I've been in roles as a faculty member and so on, I've been willing to make calls on behalf of the students that I had close relationships with. The circles of acquaintances are pretty small. People are well known, and we can, in particular, those that have been core faculty and program directors and associate directors, we know each other, and we can influence in a non pejorative way. We can provide influence through phone calls, and we do that.
Absolutely, and that, look, it's a very small world, G. I mean, and if you get a call from a fellow chairman saying, look, this kid I know, I've worked with, that goes a long way, because if Dr. Yoder would call and recommend a hospital to me or recommend somebody, I'd say about 10 other ones, go over here, let me take a look at this one. Because personal knowledge, it's just human nature that you're going to take the recommendation of someone that you trust. So in that, we're going to close this off. Thank you so much, Dr. Yoder. We have interview prep with program directors that we're helping, if you guys want to call us, and externships and all of this stuff. So I have specialists here that you can contact the office or via the website. I would like to thank you, Dr. Yoder, and just, it's really a pleasure to see how much passion you have in helping the young ones. And I wish that people would understand that just be honest and real with people when you go out there, and be teachable, like Dr. Yoder said. It's so important. You will make your way if you want it bad enough, and if you stay in long enough and you're doing the right things, no matter what obstacles you have to overcome, because someone out there will see your dedication. Keep your goals realistic, right? If you have low scores and you're way out of med school and you want to go into radiology and you're from XYZ abroad, it may not happen. So come up with a plan. You want to go to radiology, do a prelim year, go into nuclear medicine, and then you may get that way. So just get the proper wisdom to get some knowledge. We're going on close to an hour from a distinguished gentleman like Dr. Yoder, who's helped thousands upon thousands of people realize their dream residency. I hope all of you appreciate it. So in closing, Dr. Yoder, kindly.
Yeah, I think this, hopefully this has had as much value as I believe it's had to the folks on that are, with us. I wish you all the best. Be realistic, find a mentor. It's really critical to find someone that can coach and advise you. Stay clinically active if you are interested in a clinical residency. Don't give up. Some of the other things that I've seen work very well are masters in public health degrees, which go along with clinical activity, give you a set of skills and knowledge in population health and quality improvement that can set you above. But as Dr. Everest said, don't give up, just aim properly and be honest with yourself and be humble.
Absolutely. Thank you so much for your valuable time, Dr. Yoder. And
my pleasure.
I'll give you a call in a little bit to recap.
Okay.
Thank you so much. Okay.
Thank you.